So we're going to plan medication administration to avoid any interruptions, keep the medication room door closed, don't answer any phone calls, and limit conversations with colleagues. And this is our facility's no interruption zone policy. So now we're going to compare the MAR form to the patient care order form for the 5 rights. So right patient, Jaguar Jones, right medication, heparin, right dose, 5,000 units, right route, subcutaneously, right time, every 12 hours. His allergies are penicillin and penicillin. Now I'm going to perform hand hygiene. I'm going to get the medication that we'll be using, which is heparin. And then I'm going to verify the right time, which is every 12 hours. And it has been 12 hours since the last injection of heparin. And the right route is subcutaneous. I'll be using the 23 gauge tuberculin syringe. And then I'm going to clean the top of the vial and calculate how much we will be needing. So there are 10,000 units per milliliter supplied, and we need 5,000 units, so that'll be 0.5 milliliters. And this heparin is not expired, so because its expiration date is 12/5/25. So I'll pull up 0.5 milliliters of air and inject that into the vial. Tap out any bubbles. And then I would verify this with another nurse. So now I will make a label for the syringe. I'm going to write the medication name, the dose, and the name of the patient. So then I'll compare this for the 5 rights. So it's Jaguar Jones, heparin, 5,000 units, subcutaneously, this is a subcutaneous needle, and every 12 hours, and it has been 12 hours since the last injection. So now I'll take the syringe and the MAR to the patient's room, perform hand hygiene, lower the side rail and raise the bed to a working height, and then I'll verify the 2 forms of identification. So this is Jaguar Jones, MR number 4176352, 4176352, and his allergies are penicillin and penicillin. Are there any other allergies I should know about today? Okay, good. So now I would apply my gloves and my goggles and explain the procedure to the patient. So today I'll be doing a subcutaneous injection in your abdomen. So So for that, I would be going 2 inches away from the umbilicus, below the costal margin, above the pubic area, and between the anterior superior iliac spines. So now I will clean the injection site, making sure I touch every area only one time. And then I will verify one last time. So this is Jaguar Jones, heparin, 5,000 units, subcutaneously in the abdomen, and every 12 hours, and it has been more than 12 hours since the last injection. So now I'll pinch 2 inches of the skin and enter at a 90-degree angle and inject. Then dispose of the needle. Then I'll apply pressure and remove my gloves, perform hand hygiene, assess for any allergic reactions, lower the bed to the lowest position, raise the side rail, and document the procedure in the MR.